Hello, hello, hello. Me and Buddy are here and we are talking about human sexuality as part of his lesson and curriculum for today. We're covering the medicalization of sexual function problems. Yes. So apparently, Buddy has studied this. I need that. Oh, and all this. Geez, he has fidget stuff. But anyway, we're covering some stuff that is pretty sensitive to a lot of people. This one in particular is erectile dysfunction. So here we go. Question number 1. Medicalized. What does that mean?
Well, treated and dealt with in the traditional Western medical fashion, which is like finding a prescription or therapy for it. Therapy has a bunch of different meanings, so that can be like medical therapy or some other form of therapy, like psychological or just the normal like talk therapy that we're used to. But that has a bunch of different meanings, just like physical therapy is a different type. So yeah, it's applying some form of medical therapy to a certain problem or something that we've deemed an issue as a culture. So
Excellent. So by definition, medicalized means the process by which human conditions and problems come to be defined and treated as medical conditions and thus become the subject of medical study, diagnosis, prevention, and treatment. So he nailed it. Okay, so back to the question. The question is, do you think that the sexuality of men and women is being medicalized?
Sexuality,
yes,
I don't think our sexuality is being medicalized.
you do not?
I do not.
So if not, what are 2 positive effects? 1 each for males and 1 for females.
How do you mean?
And 3 negative effects. So what are 2 positives that can be gained from the use of medicine for sexual problems or function difficulties?
Oh, that's what we mean. If that's what we mean, then yes, I do feel like we're being medicalized.
2 positives and one being for men and 1 being for women, and then 3 negative effects that you learned that the medication can have, and that can be for male or female.
Well, positive effect, well, for men, it's more obvious. Erection difficulties are common, and whether it's psychological or like an actual physical problem, like their blood is not flowing there for some reason. Those are those are legitimate issues. Like and it doesn't really matter what demographic you talk to. Having problems with erection it's always considered a legitimate problem. So I'd say obviously the finding a medication like Viagra or Cialis or something like that would fix it is an automatic positive. And it doesn't have to fix it permanently, but that's also not really necessarily what we're going for. It doesn't have to be a permanent fix. You might not always want 22-year-old's erection every day you go if you're 60. That might not be the lifestyle that you're choosing to live. So, which is why like things that can work for 3 to 4 hours is kind of prime. And then for women, well, those aren't really targeted towards women. I mean, you can I guess, let me think. Well, there's a couple of different medical like medical issues that were treated with Cialis to begin with, or sorry, not to begin with, but like that were figured out that you could treat with Cialis, is like as far as the heart and stuff like that. So that's an automatic positive.
So that is Cialis is for men, correct?
No, it's for both.
For both.
The erection part of it is for men, but when Viagra first came out in the I think it was 90s, or like 80s, late 80s going into the 90s, women thought that they could take it to fix orgasm problems, because they thought it would have some sort of effect with the blood being pushed to the surface of their like various like genitalia, so they thought like it would make it easier to have an orgasm, but it was quickly realized that that's not all that goes into having an orgasm. It's just the blood retention, versus not pretty much all that goes into having an erection is how much blood is going to that area, because it's literally it's just like a hose, so that's just being blocked off. So the more blood is going to a certain area, of course it's going to work better, but that's not necessarily how it works with orgasms. So they quickly figured out that does not work like that. So even though then later on they figured out that you could use it to treat various heart problems because of the same thing where it's letting blood flow to areas that it wasn't flowing. That's a legitimate problem that many humans have, just not always with the erection. So yeah, that's another thing that Cialis is used to treat, is like various heart problems.
Okay, so let's just go to the positive for women. You said would be a heart.
Yeah, if they have a heart condition, you can use like specific heart conditions. You can use Cialis to treat. That's already like being prescribed for that. It has been for like 20 years. So like 25 years. So.
So are there any actual benefits?
Like sexual benefits for women?
Correct.
Not that I know of.
Because I know that at times some doctors will prescribe antidepressants to people who are having issues, or I'm sure there's other kind of medications that are out there that women can take in order to like speed up their libido or whatnot as it decreases as we get older, or can, I guess is what I should say. It can decrease. Anyhow, let's see. Number 2, numero dos. Do you think it would be easier to take an erection-enhancing drug than seek therapy for erection difficulties? And if so, why would the drug be easier? And what would you gain by going with the drug treatment? And if not, and therapy is easiest or equal, what would one might ask the therapist for erection difficulties?
Was a lot. It is.
It is. I can break it down smaller if you need.
It is easier, but that's also like its whole purpose.
Which one is easier?
Viagra.
To take the medication versus
medication, because I mean it is. That's the whole point. That's like it's like, yeah, of course, if you have like depression and for some like you can't get an erection because you're sad all the time, or because like your chemicals in your brain are off. You just take a drug. It's like, yeah, maybe you don't want to, or not want to, but maybe you don't. It's not necessary for you to treat your depression right then, but you do feel it's necessary to have sex. It's like, yeah, like just because you're sad doesn't mean you shouldn't be allowed to have sex. So, or just because you have like some other ongoing problem doesn't mean that you shouldn't be able to enjoy sex. So, yeah, that's like the whole point, is it kind of it cuts out the middleman. Like if you want people, like other people that like go against Viagra and other things like it, always say like, oh, well, you're ignoring the problem, or like the problem that's actually causing it. It's like, yeah, that's the point. You are, but that's exactly why it was made, is so you don't have to necessarily deal with the other ongoing problem right then. You can you can use this temporary solution to fix it, or to give you whatever you need, which is an erection at the time. So yeah, like people, I don't know, I kind of feel that like when people say negative things about it, it's not really rooted in logic, or maybe it's not really rooted in a true understanding of why it was made. Because people think that like, oh, it was made to be like a fix-all for erection difficulties, and it's like, no, it was made to be a fix for specific difficulties, and it was meant to be a quick fix, not a fix-all.
A temporary fix.
Yeah, it's meant to be a temporary fix. That's why it only lasts for the amount of time that it does. And, you know, it fulfills its purpose. It's not, like, if it was meant to last if it was meant to permanently fix your problem, it would be out of business, because it doesn't. So.
Would you say that people are misusing it if they're doing it that way? If they are using it for long periods as opposed to a temporary solution to find out if maybe something like their blood pressure is too high and that's causing them to have erectile dysfunction or issues like that?
No, I feel like you're using it, and it's one of many uses. Like, you can use it as I just need to have sex tonight. I can figure out my blood pressure tomorrow, or I can figure out my blood pressure next week. Or you can use it as, I don't really feel like figuring out my blood pressure ever. It's not really my top of my list, but I still want to have sex. So you can use it for months if you want to, years if you want to.
But then that would make it not a temporary fix. That would be overlooking
when I say temporary, I mean temporary as in it doesn't just, like, it doesn't stay. It doesn't fix it permanently. It's not like a one-sol. You have to keep, like, you know, reusing it, and you have to deal with the side effects, which is how it works for every medication. It's like, just like with like cancer treatment or anything like that, or like blood clots or stuff like that. It's like, none of the fixes that we have, none of them are permanent. They're only fixing it a little bit, and then you have to keep fixing it, keep fixing it, keep fixing it. But it doesn't actually like fix it once all. So that's why I feel like Viagra, it's like you have a bunch of different reasons you can use it, and none of them are really worse than the other. Like, you can be using it because you just don't want to deal with a different problem, or you can be using it because you just don't want to think about your problems, or you can be using it as like a temporary fix till you fix your problems. But all of those are equally valid. That's, you know, the reason it was made.
You mentioned blood clots and whatnot and problems associated or side effects from using medications. That takes me back to question number 2. And what are the, I know we're moving along, what are the negative, you needed 3 negative effects of using this type of medication? And that could be male or female.
I am not sure. So, if you don't have a proper reaction to any of these like various erection difficulty drugs, you can have an erection that lasts for a significant amount of time that is can be painful and then permanently damaging. But not only is that extremely rare that happens, when it does happen, it's usually you don't get permanent damage. Like, of the minimal amount of times that it happens, permanent damage is really rare, because they just go in and they just I don't know exactly how the chemical process works, but they just go in and they give you something that like neutralizes it, and then it just goes away. So that's kind of the pro about having everything so mainstream, is that not only do its problems become mainstream, its solutions become mainstream. So, like, if you have a side effect that's really bad, but nobody knows about it because your product is not really a big deal, when somebody gets a side effect, they're not going to know how to deal with it. But with this, it's super mainstream, like, everybody knows about it, so doctors also know about it, and when the problems arise, which they do, the solutions are already there, so you don't have to think about it. It's like, oh yeah, this one's lasting for 7 hours instead of the 3 it was supposed to, and this hurts and burns out or whatever. It's like, okay, just go to the doctor, fix it, and then go home. It's no big deal.
And what were two other negative effects?
I am not sure. So, one of them, I don't really know if you would call this, like, it's not really a side effect, but it was kind of, like, I wouldn't call it a negative thing, but I could understand how it would be seen as a negative thing, is, people using it and then never dealing with whatever the main issue is, but, because they don't need to at that point. It's like, oh, yeah, penis stops working, and then...
Got a magic pill.
Yeah, and then it keeps working for 7 months, but whatever the problem was, it's still there. It's just you've been fixing the symptom. So the problem's there, but the symptom isn't. So it's like, that's an issue. For some people, that's considered an issue, but I don't know. I don't personally consider that to be a problem. And I don't have a third issue.
Okay, well, those two were pretty strong. I would say that I have definitely used that logic and that method of treatment before for a dental infection. And they gave me antibiotics, and I took the antibiotics, and they, helped reduce the infection. So the pain got better, and I had this little magic pill. And then that lasted for like a couple of months into a year or so or more. And it was like, okay, I can go with this. I'm healed-ish. The pain's gone, and as long as I can function until the next time, then I'll be good. And so those times became less and less frequent until they didn't. And then I woke up screaming. You have to ask your dad about that. Screaming in pain because the little pill wasn't working anymore because the underlying issue had gotten out of hand. And with it getting out of hand, the pill couldn't take care of it anymore. So then I was in a worse situation than I was if I would have taken care of the problem from the beginning, because the infection had turned to an abscess and it was highly, highly uncomfortable. So I would suggest probably handling the underlying issue if it were me. But that's me projecting because I've had issues, i.e. the braces, middle age. So let's go on to the next question. Which is number 3. Let's see. Or did we cover all? Okay. Actually,
It's number 3.
Number 2, the rest of that was, what would you ask the therapist? What would one ask the therapist if they were having erection difficulties? Like, what is something that they would be seeking help for? Because you can't possibly go in and say...
Do you mean a medical?
I'm glad you interrupted me.
Do you mean a therapist as in like a psychological therapist? Okay.
Mm-hmm. Good question.
Well, kind of depends, because the therapist, I guess, really would be asking them the question, but because they'd go and they were like, oh yeah, penis doesn't work.
Well, you would contact them, right?
And they'd probably say something along the lines of, like, well, do you have a history of mental illness, whatever, but then it would go on and it would probably lead down the lines of depression, anxiety, severe anxiety, because that's like one of the most common reasons that your penis will stop working before sex, is just because you're anxious. And then like psychological problems, whether we like to see them as like physical problems or not, are. So like when you have a psychological issue in your brain, it's some level of chemicals in your brain that are not correct, like correctly being used or balanced, which leads to like physical things happening, because all of it is like real stuff. Like you can measure how sad somebody is just based on the chemicals in their brain, and those chemicals don't just sit there and do nothing. So that's kind of like a huge thing. It's like, that's why like being nervous can literally make people incapable to speak, like before like a crowd or something like that. It's like, it's not like they're just actively choosing. It's
Believe
like
me, I know.
they're just physically incapable. Well, it's because there's chemicals in their brain that are limiting their ability. So same thing would happen with your, other organs. So they'd ask something like along those lines, like, oh yeah, how were you feeling beforehand, stuff like that, because that's really what they try to treat, is the outside. That's really what they try to treat, is like the outside issues. Is they honestly don't care that much about the actual penis not working, because they're like, okay, well, that's an issue, but have you talked to a medical professional? All right, now you can come to us. I'm pretty sure that's the order in which you're supposed to do it. It's supposed to talk to a medical professional, so they check you for any blood problems first, and then you go to a therapist to understand if there's any psychological issues. Because it doesn't work backwards, because a therapist is like, you might just be sat on the side, but that's not actually the reason. But with medical stuff, it's like, all right, you're medically cleared out. Now you can go talk to a therapist. So you have to do it in that order, and not the other way around.
But if you do, you can still catch up by getting the blood work and then going back to your therapist.
Catch up also is like, it's the same thing. It's like you can't. What I'm saying is like you can't get a conclusive answer from your therapist before you get a conclusive answer from your
blood work to rule out any possibilities of it being blood related.
You have to work your way down, and you have to, if there actually is a problem, you might just been.
What types of just or one or two if you know. What types of issues would actually show up from the blood?
How do you mean?
Well, you said we need to get our blood checked.
I was saying if there's any problem with your blood, yeah.
That would cause erectile dysfunction.
Not like a blood draw. Like, yeah, you can get that too, but it's more so stuff like is your blood pressure okay? Are certain arteries clogged? Are the veins getting pressed? Because that's what Viagra does. Viagra doesn't necessarily sorry, that's not true. Viagra doesn't necessarily like give you an erection. You still have to get an erection yourself, but it makes it way easier to get one, and then it stays. But if you ejaculate, it still goes away, just like a normal erection. Like it doesn't just stay. But versus, some of the other ones it will stay. Like some I think Cialis, it'll stay there for a little bit longer. But and like some branches off of Cialis, I can't remember their name, but those ones will stay for a little bit longer. But
like a
no, they essentially relaxes like the tissues around, that makes it so it doesn't crimp your veins and other stuff like that on the inside. Well, at least the base version of Viagra does that. With other stuff, it like has different mechanisms, but that's like that's the traditional mechanism. It relaxes everything, so then it can fully fill with blood and then stay filled with blood easier. Versus like it getting too tight, and then it crimps any sort of blood flow, and then it can't stay there. So it seems like there's a bunch of other stuff that goes into that, but what they'd be checking for medically is any sort of problems with blood flow, and then
pressure.
Yeah,
pressure.
Yeah, blood pressure and blood flow. So those are the two things.
That's kind of
just cardiovascular stuff.
All right, let's move to number 3. Should a drug like Viagra be developed for women? If yes, the benefits, and if no, why not, and the possible risk.
Well, it's kind of hard to understand what exactly it would be doing, because with guys, as much as we like to say it, like men and women, we're equal but very like highly different. So like when it comes to sex and stuff like that, our sexual what's the word responsibilities are much different. So like when you have something that's penetrating something else, it kind of needs to be penetrative if that's what you're going for, like with your sex, which is kind of where the root of all this comes from, is like the general standard that you need to have penetrative sex, or like the standard that you need to have penetrative sex. So
standard assumption.
Yeah, so like, but with women, it's like, what exactly would it be doing? Like, would it be making her tighter? Would it be making that's where you have to kind of try and figure out what exactly the standard we're going for is.
Okay, let's hypothetically say that we're going for a more obtainable orgasm.
Well, yeah, so that's what all the chicks thought would happen with Viagra, just because of the mechanism, but it didn't. Apparently with some girls, though, it made their clitoris enlarged, but
I could see that based off of how we all began.
Kind of a side thing. Doesn't really relate too much. More obtainable orgasm, I guess that probably is a good idea, but I don't know, that would be, personally, I think, yes, we should, if we can make a drug for it, it should be real. If we physically can make a drug for something, we should make a drug for it. That's generally how I feel about all problems. But as far as like how, I don't know how easy that would be to convince the general public, like, oh yeah, we're going to make a drug so it's easier for women to have sex. Like, that's not really been, especially around the world, that hasn't really been, women and enjoying sex in the same sentence was never really.
Ooh, sips tea at the perfect time. Jeez Louise, son, you definitely hit right on that.
Just
one.
saying. No, I'm just kidding.
I'm just saying that one was pretty deep.
No, but seriously though, like throughout history, like the whole invention of like chastity and all those things, it's like women and enjoying sex have not really ever been partners. So,
that is absolutely, unfortunately true.
Yeah, which is, whatever you feel about it, irrelevant. It's how it is. So, that's what I'm saying. It's like, yeah, if we could do that, that'd be cool. But I doubt it seriously that anyone would really, even people that would want that probably wouldn't go for it just because it's not in our culture. So,
well, I would change the culture. Excuse me. I would change the culture. I mean, absolutely. If there was the possibility of having Viagra for women, in case I need to look it up. But
well, hold on. Define that though, because Viagra for
Viagra for women in the sense, in the context that we were talking, saying that it increases the ability to obtain orgasm in women. If that is, yeah, I would definitely be I would be volunteering to give it away for free.
Human trials.
I mean, seriously, like, women deserve to be able to have orgasms and pleasure and enjoyment the same as our counterparts. We should all be able to enjoy this beautiful act. So,
yeah, and I guess that's still kind of a puzzling question for sexologists, like forever, since they even became a thing, was why chicks have such a hard time getting one. And it came down to the point that it's not even, it has almost little to nothing to do with the guy's sexual performance. It comes down to like a bunch of different like outside stuff, just like the raw difficulty of it in and out. Sorry, how do I say this? What it takes is like wildly different for each person is the main thing, and then also from there it's like what exactly is needed. Even once you get to like all right, yeah, maybe she doesn't need penetrative sex, but it's like next girl does, next girl doesn't, next girl does. It's like it's wildly different, and that leads to just guys or the culture around it becoming different as well. So
you guys heard it here first. My son at 14, soon to be 15.
7 days.
I know, but he's still at 14 knows that it is been proven that sex is definitely, or orgasms are deeper than just the physical act.
Well, that's not what I'm saying.
Oh, I thought I heard him say that, but we can replay this later.
No, I'm saying that it doesn't just have to do with penetrative sex. Okay. Sex is a bunch of different stuff. You can have sex in a wild amount of ways. But when we say the term sex, we usually do mean, that's like, even though it's not by definition, when we say the word sex, we usually mean penetrative sex. So, like a penis going inside of a vagina. So, but yeah, that's not all it takes. It takes a lot. It might take less than that. It might take more than that. It might take not that at all. And that's kind of what leads to like a bunch of different things, but which is mainly why what matters more is not necessarily like oh, can I last longer? How big is it? Like a bunch of different just random stuff. It's like more so just like you gotta communicate because you're not gonna just. Sorry, that's not true. I'm not gonna say that. Low probability that you're just gonna figure it out by just wildly just like, all right.
Because you did say that.
Yeah, I'm going to do what I did.
The needs are different.
That's what I'm trying to say. Okay. Yeah, the needs are wildly different, which is why communication really matters more than just, like, being good at sex itself. Because you might have just, like, lucked out on the past 5 chicks. Like, which is, like, that's cool. Like, good for you. Like, you got it. You figured something out that works for the last 5 people that you were with. But, like, the 6th, it's like, why isn't it working? It's like, oh, well, you forgot to talk about it.
It's not a one size fits all.
Yeah, that's kind of the main problem, is that people think that that's how that works, but that's not. Which is the same reason, though, why I'm saying it's like a drug to make orgasms easier is like, yeah, it'd be cool.
Our mates are not a one size fits all, so you're absolutely right.
But also just like with just like with with Viagra, it's like Viagra doesn't make you get an erection. You still need a stimulus. So with an orgasm, it's like, doesn't matter if it's easy to have one. If they're not doing the right thing, it doesn't really fix the problem.
No.
So same. But that's
I like
the same
that
thing
you touched on that. I didn't even think about that. But that's correct. It's just because you take the Viagra,
you don't just like get one immediately. It's you still need a stimulus to. It just makes it easier to get one.
All right.
So, yeah, same thing. If we were to make a Viagra for women, it's, there's still if they have to take it in the first place. Sorry, if they have to take it in the first place, like they're just choosing to. It's like whatever,
So how does that look? If you if you don't have a stimulus but you still took the Viagra.
Well, with most guys that take it, with guys, a stimulus is literally anything. So like when I say that, I'm like, that's not like a joke. It's literally any sort of like, not to be rudimentary, but any sort of friction, or any sort of like touch, or it doesn't even have to be touch. Really, it can just be something that you glance at.
Some people are visual.
It doesn't have to be. You don't even have to be stimulated. Your brain could just be like, boom, there it is, and then it just happens.
Imagery.
Pardon?
Imagery.
Yeah, it could be something you think about, but it could also just be nothing. You could just be sitting there, and then it just happens. So that's what I'm trying to say. It's like with guys, there's a lot of stuff that just is just different. It's not comparable. Like we try to compare the genders a lot, and that's not really something we should be doing, because there's a lot of things that just you cannot compare between the two genders. Like,
we're gonna save that one for another topic.
Well,
let's
but, is that true though?
To number 4. Are people over relying on drugs to solve their sexual function problems?
No, but they should be.
No, but they should be.
I feel like if taking drugs makes the sexual world a better place, everyone should be partaking. Like, if you are not confident in your sexual ability because I didn't last long enough, or I couldn't get it up quick enough, it's like, I got this thing for you. If you feel crappy about yourself, you get like permanent sexual anxiety because of one bad experience where it just for whatever reason didn't work out. It's like, I got this pill for you. And then I feel like that's how we should deal with all of our sexual problems. Should be legit scientific fixes to whatever it is. Like, we shouldn't have to deal with our problems the old-fashioned way. That's the whole point of making new technologies, is so we don't have to. Like, we don't have to go get our own water because we have plumbing. Same reason we shouldn't have to be, I need to go through every single problem in my body to figure out why my penis doesn't work. Nah, skip that. Go straight to fixing the problem, which is how I feel we should deal with everything. And that's how.
However, it leaves us in a place where we didn't address the underlying issue.
That's my point. You don't need to.
So, which brings me to my next question. If that's the case, you are familiar with the term body
dysmorphia?
Dysmorphia.
Oh, yeah.
So, is there a point where excessive use or prolonged...
Wait, hold. What did you say? You can still have all the potential side effects without the stimulus, sinus pressure, headaches, etc. Oh yeah, I didn't know that actually.
So there's the negatives that I was asking for on that other question. Thank you so much.
What was I talking about?
We were talking about body
dysmorphia.
Dysmorphia.
Yeah. Well. So what's your question?
Is there a point at which prolonged use of erectile difficulty correction formulas or
Yeah.
treatments becomes a concern.
Not that I know of. I honestly, I'm not educated enough in the long-term uses of erectile dysfunction drugs to answer that to how I would, but to the extent I could. But if there isn't any, I feel like you should use it as much as you want, even if it makes you psychologically different. Like if you because oftentimes that's a positive. Like if you
mentioned depression, right? So depression was the cause of your erectile dysfunction, and it is left untreated.
Yeah, but
the possibilities of what untreated depression lead to are pretty risque.
But if your penis has to tell you that you have depression, realistically you have other problems at hand.
That's what
I'm saying that your penis
will
is
help
probably
us to figure out
the least of your issues if it's depression.
I'm not disagreeing with.
That's what I'm trying to say.
I'm not disagreeing with that.
No,
I'm just saying that where should they get the help if they just use the magic pill to fix it?
I'm saying that, that, at least with that example, the magic pill is fixing only a small portion of many problems. Like what I was saying, the potential bad part is that you would have a condition whose symptoms are gone, but the condition is still there, which is like with a blood problem. With a blood problem, it's like, that's when it's like, okay, it's your choice. Free country, do whatever you want, but it's your choice. Like, if you want to fix it now, you fix it later, fix it in 20 years, fix it now. Find out if you're 25 that you have a blood problem, but because your penis isn't working and you leave it till you're 60, it's like, yeah, that's your choice.
But you mentioned also that
one second. What I'm saying though with that is that with that situation, it's like, yeah, that's a legitimate problem that's directly correlated to your penis. So like you can get other symptoms that you might not notice with that, but that's a direct oh yeah, I have a problem with my blood pressure. I can tell because I'm at an age and physically at a certain I'm at a certain area where this shouldn't be happening, and it is, and then you go get it checked and it's like, oh, you have a blood problem. It's like, okay, well, I'm going to take this drug to make sure that my penis still works, but I still got this blood problem. It's like, that just gets rid of one of the symptoms. And that's what I'm saying with depression. It's like yeah, you take the drug and it makes it so you can have sex, but it's but you're still depressed. Wait, sorry, what? I don't agree that a pharmaceutical Band-Aid should be used without finding out what the problem is. Yeah, I don't either. I'm saying that you can find out what the problem is, but you don't have to deal with it. I think a pharmaceutical Band-Aid is it's an odd term because it is a fix for the problem that you have. It's more of a pharmaceutical prosthetic leg. It fixes the problem, but it isn't completely mending the problem. It fixes the main difficulty, but it is not completely fixing the entire arc of the situation. So with your penis, that's only one of many issues that can be happening because of a certain amount of because of some certain medical issue. And slapping a quote unquote pharmaceutical Band-Aid on it, well, yeah, now you can have sex. That's fine, but as long as you know what the problem is, it's okay. You don't need to treat it. You can wait.
Thank you so much for chiming in with that. I truly, truly appreciate a different perspective, or a perspective that also shows, sometimes leaving things untreated, it escalates. It can reach to a place where you are into a deeper depression, and you definitely, maybe the medicine is not working at all at that point, because of the other chemicals in your brain then changing as well. So there's all these different things, and I'm hoping that whoever is having these issues, actually, I just want to thank you so much for whoever joined us for our talk on the medicalization of sexual function problems. And this is a Psychology 180 class, human sexuality.
Yeah.
And so anyhow, I just thank you guys for sitting in with us.
Hold. We have one more question.
Hang on. No, we don't.
4.
Are people over-relying on drugs to solve
Wait,
their
what? Did we skip
sexual dysfunction problems? No, we
Never
told
mind. I
you
guess
were
we got
rolling
through.
But you do have a question here.
Oh,
I
sorry.
do want you to end on a couple facts, though. And the facts I want are the age.
Hold. One second. Let me read this. Are there medical issues that left untreated can kill you? I assume you mean that affect your penis. Okay. Yes, many.
I'll give you one. High blood pressure.
Yeah. That's what we were talking about. I guess towards the beginning and the middle.
I think you missed that part, but.
No. I mean, it's probably there. It's just like I was mumbling for some of it, and then also was kind of losing my train of thought. Yes, there are. And part of that is that, like, I feel that you can leave it untreated if you want to, even if your penis does work. That's kind of how, every medical problem with humans works, is you can choose to treat it or you can choose not to. Like, people that have, I have a history of seizures or epilepsy, it's like, you don't need to take epilepsy medication. If you have schizophrenia, you don't need to take schizophrenia medication. You can just go on about your days, but
and live with the consequences.
Yeah, you can live with whatever happens, and that's how that's how every part of it works. The fact that in our case your penis just happens to not work, I feel like has nothing to do with your choice on whether or not you treat it. If you treat your penis, that's a separate issue. Like, yeah, your penis might not be working because of your blood pressure, but you don't need to fix your blood pressure. You can just fix your penis, or you can just fix your blood pressure and not fix your penis. Those don't.
So to wrap that up a little tighter is pretty much your choice as to whether or not you want to deal with the lifelong effects or the consequence if it is life-threatening. If you choose to not treat and choose to just temporarily, as you said, pharmaceutically add a Band-Aid to the problem, then yeah, you do face the heart attacks and everything else that are associated with having high blood pressure or whatever else. What are the?
I want to read this. Okay, I appreciate you clarifying that. It sounded like you were saying don't worry about why it's not working. For some of the things.
Well, he
hold on.
didn't mishear him.
No. For some of the things, I have to say, I am kind of saying that, because I feel like you can fix your penis, but you don't necessarily need to. I feel like you should always go figure out what the problem is, but you don't necessarily need to worry about the problem. It's like if you have depression and your penis isn't working, but as long as you know that that's the problem, you're set. You're set. As soon as you know that it's depression, it's like, yeah, it can be sad, but that doesn't mean I don't want to have sex. Like I can not want to get out of bed.
A lot of times it does.
No, I'm saying that's.
Just saying. A lot of times that does.
You're missing the point, though. I'm saying. Okay, I'm saying that a person that has depression, or let's say a person that has severe anxiety, they shouldn't be excluded from the pool of people that get to have sex. Get to have like actually, or not actually, they get to have sex is right for them. They shouldn't be excluded from that pool just because they have some other issue. It's discriminatory to, which is why we make certain drugs and stuff like that, is to be more inclusive with various groups of people. If you have, just because someone has some ongoing brain issue, they have some ongoing whatever problem, it may not be able to be fixed tomorrow. It may not be able to be fixed in months. May not be able to fix in years. Some people have ongoing depression for 10 years, ongoing anxiety issues their whole life. That doesn't mean that at no point in that they don't want to have what's the word? They don't want to have good sex. Good is a bad adjective, but you get the point. They want to have good sex, and they shouldn't be excluded just because they have some problem. Yeah, you can go to therapy, or you can go to therapy for 15 years and not have any conclusive fix to your anxiety, conclusive fix to your depression. That doesn't mean that at any point in those 15 years you didn't want to have good sex. It's come on. That's why we make new technologies. That's why we make solutions to our problems, is because there might not be a fix as tomorrow, but we do have this pill.
Pull this in, you guys. So you heard from my son here. If you are a lady and you're having issues with reaching orgasm, it may not be you. It may be your mate. I mean, I know.
When did I say that?
This is a joke.
Oh.
This is a joke, lightweight joke. It may be your mate who might be suffering from depression and is choosing to just go ahead and give a pharmaceutical Band-Aid or a little pill to fix or mask the problem at hand. And as we also, I think, touched on, that it's a little deeper than just the physical act. So when you combine all that together, you might need to talk to your mate and see if the issues with you obtaining an orgasm might have something to do with maybe your partner not being fully present or fully able to make the body meet the physical reaction of the medication. So with that as one of our final notes, I would like my son to give us 3 of your best tips or topics or something you learned, facts that you learned from this lesson. Definitely one of them I need to be, actually this is a bonus, I need the average age that...
I got one right quick. 3% of men in the U.S. aged 18 to 60, I think it's 65, or 67, use some form of erectile help in their last sexual some sort in their last sexual event.
What was it?
Which 3%, which it doesn't sound like a lot, but that's also kind of is if you take 100 people, 3 of them, and there's how many millions of people in the States? That's a significant amount of people. With ages 18 to 25 though, with ages 17 to 25, it's less than 1% was using it, but then with ages what is it? I think it was 55 and up, it was higher than 5. So
and this is dated as to 2000 something.
It's 13, 14. Okay. It's relatively, it might have gone up because we got new and better drugs, or it might have gone down because of culture or something, but so it's 3%. Around there,
Okay.
3% is still, it's less than I expected, but that's still a lot. That's I would have expected somewhere on the order of 8%. A little less than 1% out of every 10 was using some sort of erectile health.
And what was the average age that men would begin to notice or have erectile dysfunction issues?
That's not answered. That's a hard thing to average because it happens at every age.
I have to use the restroom, you guys. Whew. Okay, give him 2 more. I gotta go.
You can feel free to let me spiel.
Actually, just give me the last 2.
Last 2, let me think. Man. Let's see. Oh, yeah, that was one I thought was interesting. With the lesbian and, the lesbian women community, turns out, comparatively between the straight and lesbian groups, the majority of lesbian women had a problem with... Wait, hold on, let me just check. Okay, yeah, they had a problem with assertive cunnilingus was their main issue, whereas their counterparts, the straight ones on their counterparts, had a significant problem with reaching orgasm. That was their number one problem. Whereas the lesbian group is the same general demographic, so same general amount of whites and blacks and Asians, the same general amount of 18 through I think it was 45, had little to no problem with any sort of orgasmic difficulties. So, food for thought, you know? That's interesting. Not really surprising, might I say, but interesting nonetheless. Let me think of a third one. This is not really in this chapter, but turns out Viagra was actually made by accident in a lab by Pfizer. And they were originally trying to make a drug that could treat various heart problems. And as the story goes, whether or not this is completely true, this is what they said happened. As the story goes, they were, there was like a certain, I think it was 8 or 9 lab like attendees that were in there, and they were just doing various things, doing their jobs, all various levels of doctor. And they were studying they're studying the drug that they were working on just to treat various heart problems, and like loosen up the valves a little bit, you know, the works. And then some of them like spilled some stuff and got it on their hands, and they thought nothing of it. They just cleaned it, like did the traditional like chemical like cleaning, everything like that. And then the next day they went in again and like okay, yeah, they're okay. They realized nothing happened with that, and they just started working it on the various items, just like hand to hand, nothing big deal. But they started noticing like over time, some of them started getting like almost every day, like 3 to 4 hour erections. Like the whole time they were at the lab, they were getting like rock hard erections just the entire time. And then like the number increased as more people were going into the lab. And then finally somebody said something about it, and then everyone else in the lab was like, oh yeah, that happened to me too. And then they figured out what it was, like what the chemical mix was, and trademarked it. Or I guess patented is the correct term. And then that's where Viagra came from. So that was in like the 90s.
What was your facts?
First one you already heard. Second one, I brought up how lesbian women and their straight counterparts, like the same general demographics. The lesbian women had a problem with like a assertive or domineering cunnilingus was like their main issue, whereas their straight counterparts had a significant problem with orgasmic difficulties, whereas the lesbian ones had no problems, or not no problems, but very, very minimal problems with orgasmic difficulties.
Different chapter.
No, that's like that page right there. There's like a 2 paragraphs before that.
Okay. Different topic. That's what I meant. Different topic, I guess.
Yeah,
but
that was another interesting thing that I read.
Thanks for sharing.
Yeah.
Well, thank you guys so much for joining us on the medicalization of sexual function problems. And me and Akio shipped in here and our chat. This is what I call this time that I spend with my son as we homeschool. As you guys know, we've homeschooled our children and still continue. So the ball keeps rolling, and we're going to get in here and move on to what comes next.
More reading, and then
history. We are studying ancient China.
Oh yeah, that too.
Ancient China. So that's where we are with all of our learning and all of our wonderful day. And then we'll probably get out there and power wash some stuff and all that good stuff. So you guys enjoy your day. Enjoy fun in the sun, the rain, or whatever, snow, trees, whatever you have. Enjoy the cherry blossoms that are starting to take over in the Pacific Northwest. They are absolutely beautiful. I'm sitting here looking out the window, and my neighbor just has like the most beautifully deep rose-colored blossoms. And above those, bright, like pearl white. I might have added the pearl in there, but the white on there is just, it's so beautiful. Kissed with the backdrop of the green and the multicolors of green that are here because of all of the rain that we usually, I shouldn't say all the rain, all the moist and mist that we always get. So thank you guys again for joining us, and I hope you enjoy your day, and I look forward to, hi Aunt Sylvia and Cheryl. John, thanks you also for joining us. Yeah, Lieutenant Dan, I got you. Everybody, I enjoyed you. Enjoy your day, wherever you are and whatever you're doing. Make the best of it. Be appreciative for what you have. Yeah, take a look around at all your junk and just embrace it. Like truly, like start to embrace it. Embrace these little pieces that we have created here. And enjoy them even when they're being snippy or their views or opinions don't match ours. And we definitely run into a lot of that in some of these chapters. So hopefully you will join us again. We love you guys. Peace. Thanks, son. I appreciate that.